When people ask me to describe cognitive behavioral therapy, CBT, I generally say it's basically don't believe everything you think. And in describing dialectical behavioral therapy, I say that it's don't believe everything you feel. Of course, that's easier said than done. Don't believe everything I think or feel? But this is the cornerstone of therapy, and yet it's extremely difficult for people to question their own thoughts or their own feelings, not without a lot of practice. To give you an idea of exactly how hard this is, I want to tell you a story from my piloting days, when a very simple demonstration provided by the FAA showed me just how fallible our senses can be. For me, it was nothing short of mind-blowing, and it changed my trust in my own brain profoundly. In order to understand the story, you have to know that there are two different types of private pilots. Those with instrument ratings, meaning that they can fly in the clouds or poor visibility. And there are those who have what's called visual flight rule rating, or VFR pilots, which is what I was at the time. With a VFR rating, you're not allowed to fly in the clouds, and you actually have to keep a significant distance to remain clear of them by law. But even in training for this rating, you still have to learn to use all of the instruments in your plane, including the most important instrument of all for flying in poor visibility, the artificial horizon. You're told by your instructor over and over, trust the instruments, not your feelings, because those will get you killed in poor visibility. It's actually what killed John F. Kennedy Jr., who had a fully equipped instrument-rated airplane, but not the instrument rating himself. See, the problem is we have these things called semicircular canals in our inner ear, which tell us whether we're upright, spinning, sitting still, when you turn your head to one side or the other. It's actually a really cool system under most circumstances. They're little fluid-filled rings that respond to head movements. The problem is our brain is constantly checking these sensations against what we see in real life and making natural corrections. When we have no reference, such as a horizon to compare against, well, our brain does some pretty wonky things. So let me set the scene. I'd flown my little 1946 Cessna 140 to the world's largest fly-in of private airplanes held in Oshkosh, Wisconsin. There are all kinds of demonstration booths, and the FAA had the one that so messed with my notion of objective reality. In order to participate, you had to have several hours of pilot-in-command experience, meaning you flying the airplane yourself, to ensure that you were at least a fairly seasoned pilot. And you could not be instrument rated. The setup was extremely simple. It was a box with a chair inside and a very basic flight simulator. The only instructions were, don't crash the plane. Although they also told you you will crash the plane, you won't be able to stop yourself. Now, I consider myself fairly intelligent, and I know what they're going to do. They're going to reduce the visibility, and then they're going to try and fool me into making some mistake that would be lethal under normal circumstances. So I'm all prepared. I'm absolutely convinced that they're not going to get me. Now, one thing I forgot to tell you is that this box with the simulator inside is slowly spinning during the entire demonstration. You can't see out of the box. All you can see is the screen in front of you. You have pilot's headphones on that you will use to talk to the controller who's outside of the box and who will be giving you simple flight instructions like headings and altitudes. So I sit down, I make myself comfortable, put on my headphones, they start the simulator. Not surprisingly, I'm flying along, straight and level, no problem. Now initially, you feel the spin of the simulator, but as your inner ear begins to compensate, it feels like you're sitting perfectly still. Very similar to when you're driving in a car or flying in a commercial airplane and you don't feel the motion once you're going at a steady speed. Soon, completely expected, the visibility begins to get worse and worse. Now there's an artificial horizon in the simulator, and I automatically start to check it every few seconds as part of the scan that I learned in training, even VFR training. Soon, it's completely white, like it would be in the clouds. And all I have are the instruments. But I'm following all the commands of the controller, such as turning to a certain heading, and I'm feeling quite pleased with myself at this point. Casually, the controller asks me to pick up a notebook and pencil that are lying on the floor next to the chair in the simulator and write down some instructions. So like a good pilot, this is exactly what I do. I bend over to grab the notebook, and I almost instantly get an intense tumbling sensation, as if the plane is rolling out of control. Immediately, I reach up for the controls. I try to correct. The door's open. The FAA person outside says, "Get out, you're dead." Next. What happened? Well, what happened was, when I bent over, my head changed position, and my semicircular canals were now spinning in different directions than the simulator, creating this incredibly intense tumbling sensation I felt. What did I do next? Exactly what I was taught not to do. I immediately grabbed for the controls and tried to correct for what my body was telling me was going on with the plane. Now keep in mind, I'm in a chair, in a box, on the ground, in Oshkosh, Wisconsin. That box couldn't be tumbling unless we were in the midst of a magnitude 7.8 earthquake. But my instinct was so strong that even though I knew those facts, knew that this was a test, knew that they were going to do something to try and fool me, I reacted on the signals coming from my brain. Completely wrong signals. I've since done my instrument training, and one of the things you learn over and over is that a plane flies itself under normal circumstances. So what I should have done was nothing. I should not have touched the controls. I should have immediately looked at the artificial horizon. I should have trusted what the artificial horizon would have told me, that I was still flying straight and level. This was the point at which I realized the incredible power of sensations and feelings and emotions, especially when they're in error. A great deal of CBT is trying to convince ourselves that the thoughts we are having may not be accurate, may not be what's really going on. However, our instinct is to trust our thoughts implicitly, to the point where it becomes extremely difficult not to act on them. In DBT, we're trying to instill the idea that you may feel something, and while the feeling is real, just like my sensation of tumbling was very, very real, it may not be accurate. It may not reflect what's actually going on. If we can learn to intercept these feelings or thoughts before we act on them, test them, or at least question them, we can often successfully stop old habits and old response patterns. But just like it took me 30 or 40 hours flying under the hood in my airplane, not allowed to look outside, having to fly only by the instruments, no matter what my sensations told me, and with a trusted instructor by my side, did I start to master the task of overcoming what my mind and body were trying to tell me. As a result, I'm fond of telling my patients, you need to learn to trust external instruments. And by this I mean checking the evidence, challenging your thoughts, trusting your providers when they tell you things that feel counterintuitive. But it's not easy by any stretch of the imagination. So if you take nothing else away from this, I hope you remember, don't believe everything you think. And sure as hell, don't believe everything you feel. Also remember, mental health and physical health, they're the same thing. See you next time.